In the middle of a global pandemic, the opioid epidemic affects over 10 million people, their families, their friends, and their communities.
Crush the Crisis opioid take-back events are one of the easiest ways that we can address this crisis together.
The success of these events is not possible without the help of thousands of community members, hundreds of HCA healthcare colleagues in dozens of cities across the nation.
It's important now more than ever. As CDC reported, over 96,000 deaths due to opioid overdoses during this year between March 2020 and March 2021.
1 in 5 Texans has experienced an opioid overdose or knows someone who has. Actually, just recently, a 12-year-old girl came into one of our ERs and passed away from a fentanyl overdose. This is why we want to make a difference and participate in Crush the Crisis.
As a pharmacy resident, I did have an emergency department rotation, and just seeing the amount of opioid overdoses that we have almost on a daily basis just kind of hits home. It's my own community being affected by something like this. So I figured anything I could do to help, just to help get the drugs off the street, that's just the rewarding part for me.
Winning the battle against the opioid crisis is a team sport. That's why in all of our local communities, we partner not just with our hospitals and providers, but with local law enforcement to ensure education and safe collection remain at the forefront of this initiative.
They appreciate our organization. Law enforcement is aware that we're part of HCA. We're both out there for the safety and health and well-being of our community, and to share stories and to build that rapport is probably the thing that I look forward to the most.
In the past few events that we've had with Crush the Crisis, we've had the police department here in our community come and participate with us. And they were actually not expecting our events to be as successful as they are. And I say that because they brought 2 cars. And so they actually haul off the medications once we probably put them in the correct bins. And they had to make multiple trips.
It's important to make the time. I know a lot of folks can argue that we don't have time, everybody's too busy, but for something this important, it is important for us to make that time to show the community that we do care, and also to remind the community about how important this epidemic is, not only the pandemic of COVID-19, but there are other safety issues out there to address.
In 2020, even during the pandemic, we collected and safely disposed of over 13,000 pounds of medication. With the help of 95 facilities across 18 states, we removed 9.3 million doses of unused medication.
I'd heard stories of how much they had brought back the first year. I've heard of different take-back events before as well, but just seeing it firsthand, it's incredible.
To me, Crush the Crisis saves lives. There are drugs that end up in our bin that would end up in somebody's body, possibly in a lethal dose. I can't stop somebody from overdosing, but that pill that they would have taken, that's in this box and it's going to be incinerated.
Caring for the community is not just a tagline, it embodies the way that we feel. Crush the Crisis events offer us an additional way to serve our communities.
I feel grateful being able to give back to the community, but also feeling at the end of the day that I did something or made an impact on potentially someone's life.
We're very excited to really make a difference in our community and save lives.
The Crush the Crisis opioid take-back events brings me an immense sense of personal pride to be a part of an organization that brings healthier tomorrows to the communities that we serve.